Hi, welcome to today's Telehealth Secrets webinar. Sorry for the slight delay. We had some technical issues, but I just want to make a few quick housekeeping announcements. Let's see, here we go. Yeah, so today's session will be recorded. And what is happening? Okay, yeah, so today's session will be recorded and it'll be made available following the session. You can submit your questions for Milton or for our speakers via the chat. And if you're interested in partnering to support Ukraine healthcare, you can contact us at amy4ukraine@VSee.com or donate via our nonprofit partner, AmericanDuty.org. So without any further ado, let me go ahead and turn this time over to Milton and Zoryana.
Hey, thanks, Anne. Hello, welcome everyone to another segment of Telehealth Secrets webinar. This is where we talk about the insights and telehealth. And my name is Milton. I'm the co-founder CEO of VSee Telehealth. Joining us today live from Ukraine is our special guest, Zoryana, the Ukraine Minister of Health from 2019 to 2020. So she has 20 years experience in medical and pharmaceutical law and policy making. She's currently the head of medical law at the Ariel law firm, as well as the professor at the law school at Kiev Academy. And something really fun about her, outside of her professional accomplishment, and Zoryana collect brooches. I think you have collected over 400 so. Okay, yeah. And we are really, really honored and privileged to have Zoryana on the webinar with us. Again, really, really appreciate having here. I guess, Zoryana, maybe just to get things started in this, so we definitely would love to hear about your, what's life like right now, and again, just your thoughts and sharing things in healthcare. What are the things the audience members should know about? What's it like?
Now, for now, just in this moment, we have air alarm that they started 20 minutes ago, and I hope during this our meeting we will not have surprises from the air. And mostly Western Ukraine, where I'm here now, it's a more safety place, but it never knows what can be happened. And in the same time, most of Ukrainians returning to Ukraine from where they spent maybe 3 months, last 3 months, and understand that they should be here, should be on their workplaces, even it's not the doctors, maybe teachers, and most Ukrainians trying to back home because it's our state and our home generally.
Okay, how frequently does the bomb alerts goes off? Is it like hourly, daily, or how, like, what's it like?
If we will take Western Ukraine region, it can happen maybe once or twice a day. When we, for example, will say about Kiev, it's the capital of Ukraine, it happens only 3 times on the night. All night can be on our alarm. So I have been in Kiev 3 days ago, so it was twice a day and 3 times at night. So it's too much. And if we say occupied territory, it's 20% of Ukrainian territory now is occupied. It's sometimes more dangerous even than I just mentioned.
Yeah, that's just for the last 3 months or 2.5 months, constantly going. That must be the mental health, just the toll on people. The stress level must be enormous.
For some part of Ukrainians, is this situation for mental health and PTSR also it's starts from 2014, so 8 years for a lot of Ukrainian people, doctors, militarians, volunteers. It's long time story, but for most Ukrainians, for internally displaced persons, for persons that as a refugee leave Ukrainian territory, up to 5 million, as we for now accounting. It's yes, for them it's higher level stress, and only now they are just going to next stage of just sometimes shocks stage. What really happens, and never we will live in the Ukraine that was before 24 February.
Got it in there. So one of the things I know the audience members, I think they'll be really interested to know is what are some of the key differences of the Ukrainian healthcare system that like an outsider, NGO who want to help, like what should they understand about how the Ukraine healthcare system?
I will try to be more shorter because I can explain maybe more maybe 1 hour just about Ukrainian system. But if key differences, maybe I just mentioned 4. Main key. First one is that we have 600,000 medical professionals, and it means that we can really cover a lot of patients and taking to cover Ukrainian huge territory. But at the same time, we haven't medical self-governmental association that really manage all medical professionals, giving them license to practice and so on. Second one, it's that we have almost more than 5,000 medical facilities and hospitals. And it's some heritage of Soviet Union times. And we, last 4 years, we're trying to make some reorganization, transformation, and create new roads for patients between all of these thousands of facilities. But at the same time, haven't not enough equipment, and we really started to on modernization of these facilities. Modernizations meaning not only just equipment, but also beds, just all IT, logistics, and so on, storages. So it's not only buildings, but hospitals sometimes it's more questions, and we're trying to work on it. Last only 4 years because before it was only as we have. Third one is that we have. I hope we still have 40 million people, and 70% of them it's a population between 15 and 64. So it's almost healthy people. We have 50%. It's the children up to 14, and so it's 50% elderly people. We have not very much level of the living, but we will start. We are working on it. And first, I think that it will be interesting of Ukraine. It's that we have not medical insurance system. Our financing system is is going money from budget to national service, national health services that are working under Ministry of Health, and they are financing, have a contract with hospitals. So for now, we have just this is a similar system with UK. But not similar for most European countries, for United States, where you have this insurance programs for different groups, for different companies. In Ukraine, we just only have voluntary programs, but it's covering maybe 2% of people, and it's mostly by international companies.
Got it. So essentially, this is for Ukraine is you have roughly about 100,000 medical personnel spread over about 5,000 hospital clinic across, serving about 40 or so million people. And then you have a national universal healthcare systems for the population there. Got it. That may really help. I appreciate it. For Zoryana, can I ask this, what are the top 3 to 5 challenges facing the Ukrainian healthcare now? Like, for example, if you have the top burning problem? What are these?
Yeah, we have before war we have a lot of challenges in healthcare system, and now if you have additional challenges, I could just mention that the first one is we have internally displaced people. It's almost 8 million people. It's each 6%, and 60% of them it's a woman. Sometimes they are with the children, so it's overloading of doctors in western region of Ukraine, where they have a lot their own patients, and additional that comes from eastern part where we have this more active phase. And also, if we just want to add to this, it's destroyed 40 hospitals and 500 hospitals are damaged. So it also means that we have a lot of patients that can't receive enough medical services and help. Second one is damaged logistic of drug supplies. It's connected with because roads are destroyed, because some regions are occupied, because some storages were destroyed, because some pharmacies are closed. So most generally, it's really complicated just to have access to medicines for patients. Third one, it's a new types of traumas and public health, mental health, health problems, and also for chronic ill patients. Also, they have let down their health because they have additional stress. And it's really sometimes need more time spent to new maybe additional diagnostic and maybe new plans of treatment. So next one, we just paused a lot of changes that really was important for Ukrainian health system. It's we paused long life education, medical education, improving managing because improving these packages of national health service that we about financing hospitals, because all time we are just working on improving this financing of hospitals. So it's all of these changes, positive changes, it's very high needed are on the pause. And fives, maybe it's very serious. It's oncological patients. Almost it's very serious for situations. The first 2 months is with children, and we are very thankful for all our friendly countries that take these children and patients to different countries to this very serious. Sometimes for oncological stages and treatment, it was very serious not to interrupting and the treatment, and it's worth in most situations really we receive this support and help from other countries. So for chronic and oncological patients, and maybe the most critical situation is for example, the palliative care patients, and palliative care, because sometimes it's really just non-medical professionals to help because it was required. And it's very complicated to take them because the roads are destroyed. Also, just take them to other part because it's combatants, Russian soldiers just attacks all hospitals, medical transport against all international humanitarian law.
I see. That seems, wow, with this set of challenges, these are almost unimaginable. If, I guess for these were 500 or so hospitals that have been damaged, and are they still able to do some operation where these are just, they had to ship the research to the other hospital? That just seems such a huge number.
We have sometimes in Ukrainian, in the eastern part where we have this active periods, we have very heroes, doctors that are doing very sometimes serious operations, even on basement, for example, without light and electricity and so on, and helping a lot of Ukrainian patients. A lot of Ukrainian doctors also living weeks, maybe months in hospitals, not because they haven't even the ability to just to to their home because it was dangerous for their life. So yes, I think after finishing this war, after victory, we will have a lot of heroes' histories.
Yeah, that is just such a touching and wonderful to hear. And it's for these physicians to step up and care under this most extreme situations there. I guess for if we were to deeper dive into the healthcare situation in Ukraine now, for example, from the patient's perspective in this, I was thinking if you can maybe share with us a little bit more, maybe some of the specific healthcare challenges from the patient's view. Is it like just for them to access to, is it getting the right medication? Is it a specialist? Is it just so they live in a more rural setting? There's really just can't get to anywhere. Like what are these things that like patients facing? Yeah.
These patients, yeah, we have a lot of, I think, troubles, but maybe I just mentioned one story. Then sometimes we're saying that we have challenges with access to medical services or medicines, drugs, but we have such, for example, stories was in the first months of this war active phase, where the Russian soldiers don't allow to take a pregnant woman to the hospital, just because they decided she will not go to the hospital. And that small village, there wasn't hospital, doctors and nurse, just there was only just medical assistant. And when they understand that she really needed help and Russian soldiers not allow, and it's really dangerous, they can just shut them of the family. They use a phone. They call to the doctors, to the hospitals, to the hospital, and they just consulting all times this medical assistant, and the child was born very healthy and everything is okay. And it's very the very importance of this access to internet or mobile phone connection in this case, as when we have this telemedicine in real life in time of the war in Ukraine in just 21st century. And we are lucky that everything happens well, and it was not needed additional support from medical professionals and doctors. We are lucky that there was a mobile connection, and it's really a possibility to call to some doctors. But we have such cases in this 3 months in Ukraine, not one of them, but also now from military and doctors also, they using a lot of consultation via phone, internet. If we are talking about patients, so access to medical services. If we are talking about Eastern Ukraine, and just mentioned that it's really sometimes sometimes a problem because it's a destroyed hospitals or destroyed roads, or just it's dangerous to go out from your home. And sometimes phone or internet is really helping. If we are saying about Western Ukraine, it really can be not very problematic, but receive to have a visit in short time to the doctor because we have a lot of patients. But at the same time, patients that have a declaration with a family doctor from Eastern Ukraine and comes to Western Ukraine, they are calling to their doctors by phone, not going to Western Ukraine doctor because I have my own family doctor. So it's really a good one because sometimes family doctors, their family doctors are abroad, for example. So it's just globalization and helping in this case also. And it's very great to say that not. I haven't heard a situation where the doctor said, "I will not receive a money for your call or visit or in electronic consultation." And they are helping for all patients. And another one is access to medicines that I just mentioned, but also it's additional situation that we have introduced to medical practice. It's electronic recipe, and we just make them for some state program for access to medicines for free for patients. And now for some cases we are just needed, a Minister of Health needed to create, to make a decision to use as type electronic recipe, just a traditional recipe for such medicine. And additional situation, it's about second opinion, because mostly Ukrainian patients are using online consultation as a second opinion, because sometimes it's really complicated to find the same doctor with same specialization in their own place. We have a lot of private clinics that provide such possibility to consulting via online. Via some telemedicine platform and so on, and I think it's this right of the patient to have a second opinion are not using very often, but for this, in this stage in the work time also, they really trying to get more possibilities. Even it's sometimes they are abroad, for example, because Ukrainian people, they haven't this medical insurance, and they really have this practice just to go to doctor and to have a visit, electronic procedure, but it's very short time taking to have a visit to the doctor or specialist. And then they are now in the European countries, and they just need, they have some questions for the doctors, and they receive the answer that they have, for example, 3 weeks or more than a month wait for this visit. They just say, you know, I will just call to Ukrainian doctor, it will be in short, take a time. So they sometimes are looking for this second opinion in Ukrainian doctors via internet. Additional situation, maybe it will be more interesting in using this technologies. It's rural areas in Ukraine, because we have 30% of population before war. Now I think it's very complicated to say how it really looks like, but it's 30%. It's rural areas, and in some of them, it's really can be complicated situation to have possibility to meet a doctor, because sometimes only a medical assistant or nurse, and we have in some regions not systematically, but they are trying to be covered by some bigger hospital through some online consultation, online visits, and this part of Ukrainians and very huge territory of Ukraine really needed to use this digital civilization, internet technologies for access to medical consultations, even some new recipe, for example, or some second opinion, and so on. And mostly it's complicated for elderly people, but it's relatives, younger relatives really helping, because sometimes for younger relatives it's more it's more easy just to buy a smartphone, put at the home, and say, you know, if in some case you just call the doctor and just put these two buttons. And also in these 3 months, I heard a lot of stories when the very elderly people also, but that they have the smartphones really by self calling to doctors, managing all their needs in healthcare, and it's very positive, surprising, I think, from about. I know that there were some questions about elderly people, and I just need to mention that, just in case in this place, I've just mentioned that elderly doctors, I think it will be a more complicated case to use smartphones because they are just very high status professor or something like that, and they're just using help of assistants and not going to online consultation. But maybe we can find some good cases also in Ukraine. And I think the biggest challenge is not understanding the all serious situations that can be caused with the privacy, because a lot of patients are using just typical messengers like a Viber, and not or sending just via some SMS or I know email, all documents, not trying to even just make some PIN codes or something like that. So I think this it will be next stage to explain patients this situation with privacy, and maybe for some first two cases it will be complicated results. So with patients, I think it's enough. Maybe just to say that we have very passive patients and not maybe sometimes very active, but sometimes very not very simple.
Okay, can I ask this? So you mentioned, for example, the patients, the elderly, and they're just used to, using these for consumer messenger to like Viber, WhatsApp, and these. Now, do they still book appointment with the doctor, or do they just call the doctor? And I guess the reason I ask is, imagine what is a doctor's like? Do they just go say, have an in-person patient? The next one will be a call, or would they just get random calls and they have to say, put a patient on hold, handle this call? Like, what's that like for the?
So both ways, because for medical information systems that are using in hospital, also sometimes some of them are provide also this possibility via apps, some on the phone, make these visits, but at the same time you just can call to reception of the hospital.
Okay.
Receptionist will put their visit on the same system, else it will not be conflicts of visits in this.
Okay, that makes sense. In the other way, I think for these calls, it could be overwhelming, especially on the physician. I guess, Zoryana, thank you so much for teaching us about from the patient's perspective. How about from the physicians, from the doctors? What are the key challenges that maybe like facing the physicians?
For physicians, if we are talking physician like a very important and very serious profession, I think it's very important that to understand that we have on this individual licensing. So we are not controlling as a medical society, each doctor, each medical professional. So sometimes medical professional society can't weed out these incompetent colleagues just because they have the same legal basement like a diploma, and it's enough to have a practice in Ukraine. We have no ethical code. We have no ethical commission. So no some these professional exams, and it's really everything that we need just to for all doctors to be legally practice, to have legal practice, to be employed in hospital, or to be self-entrepreneur. And it will be enough to practice without additional. And sometimes doctors see that they have patients with bad results from previous medical professional recommendations, for example. But we haven't this instrument of how to make this image of the whole doctor prestigious and so on. And now in wartime, we have, especially where it's hospitals destroyed or territory occupied, we have a lot of doctors that lose their job or lose their job in their home, and they are looking for some additional new places. I have some each week. I have additional 2 or 3 cases with CVs that are just asking to send places to maybe somebody help, and really most hospitals taking them. It's a very good positive atmosphere now for this time of the war. And second one, it really also has this serious impact on the medical professional activity. It's managing quality of management in hospitals, because we have no HR policy.
Okay.
It's no qualified managers in hospitals, and sometimes it can be talented by the nature. Sometimes it's really brilliant. In one of them, it was in Kramatorsk on the eastern part of Ukraine. It was brilliant manager of primary care hospital, very huge for all city, and I hope he will be healthy and continue his job afterward. And also most hospitals, they have a motivation policy also. So for a lot of doctors, they just sometimes they burn out and just as I'm saying, that a doctor is patient, fighting by both in this pair, in all of their challenges in this treatment process, without helping of the hospital and managers. And sometimes it's really taking too much force from the doctors. Education also not motivate, not support, because last 2 years we have this online education. Most of the medical universities, not that we have 7 medical universities, bigger medical universities. We have 14 under postgraduate universities, so institutes. So we have a lot of medical educational institutions, but in the same time, they're not adopted to online education, not programs. And it's the biggest problem is my practical skills, because they have practical classes. And also we just introduced maybe 2 years ago, this long life education that all doctors should collect credits for each year. And also previously it was limited online courses. Now they have possibility to have all credits online, and also this year they are not obligatory to collect credits beyond the line. But in the same time, not all doctors understand how it's really important to have this long life education. That's why also we just mentioned that most of them they will not understand that mostly they will be that incompetent colleagues that in most countries will be just on blacklist. So but maybe in some day we will have also. And salary. With salary, it was really complicated situation, and we're trying to raise more money in budget of the state to healthcare, to medical services. And this year it was planned to be very good year for doctors, because it was rising for all doctors basic salary. For that moment before war, it was 740 USA dollars.
Okay.
But now it's only 500.
I see. You say so before the war, it was a physician will make about $740 a month.
Before last year, it was only 200. This year we start with really rising this. It was 740. But now we have the change of the rates of the USA dollar and Ukrainian hryvnia. So for this moment, on 3 months, it's only $500.
I see. Yeah, that is fairly low to the in there.
In the same time, Ukrainian doctors now really have very high qualified operations and treatment for people that have serious damages from eastern territories, where they have loses a lot of blood, hands, legs, a lot of other traumas. So they are very high qualified, and at the same time they have not enough salary.
I see. That makes sense. Thank you so much again for teaching. This is really, really insightful. I'll say for the maybe the audience members, feel free to put your question in. I think and will help sort them out. Please, we're really, really honored by the Zoryana to have you with us, and thank you so much. I guess I want to maybe ask you something about more system view of the Ukraine healthcare system. I think you mentioned about, for example, what are some of the initiatives you guys have maybe around a public-private partnership, because often that might be a mechanism to boost up the healthcare system, especially in the times of war.
Yeah, I will say especially about PPP, but previously I've just said that just only last 4 years we make changes in financing system of healthcare, and but only previous 2 years it was changes in primary care, and last 2 years we just covered second level, and it was just only initial stage of changes and creating new financial system. And this aim of this all changes, it was just to become more to create all hospitals more convenient for competition between hospitals, between hospitals, state hospitals and private hospitals, and affect improving of quality of medical services, because medical services, it's not only just qualified doctors, but more others factors, and we just initiate, and now we have this additional case. And if we are saying this financing, it was first stage, and second one, it was about saying about additional investments in healthcare system. And PPP, public-private partnership, it's really one of the best way to bring more investments in hohealthcare, because we have a lot of good doctors, we have very good potential and territory and buildings. Sometimes hospitals are very close to airports, very good transportation and logistics territories. So, and this before war, I hope it will be next stage will be more interesting even for investments, because we're discovering, we're developing that medical tourism, it can be very active but developed in Ukraine, and not less than in Turkey, for example. And at the same time, in hospitals, sometimes we need just not huge money invested in some hospitals, because some of them just need new equipment, maybe some repairing, and it will be very good one to providing a lot of medical services. And at the same time, we need same time just need to mention that we made very huge job before to preparing this PPP possibilities in Ukraine, because we have changed the legal form of hospitals and make them like entrepreneurs, so they can be just a partner of some such agreements. And I think that for some people it will be just very strange to think, to thought that how you can say about investment in the country where we have the war time now. But hospitals, sometimes you need to spend a lot of time of preparation just to found hospitals that you want to found, just to want to invest. You just need to make some audit, to some information collect, and to a lot of analytical job before you come and just bring your money to that place. So I think that our war will be finished this year with supporting all of our countries and USA also. I'm very thankful for that. And I think that this PPP investment projects in Ukraine, it really will be also possible to start think and maybe speak about them even this year also.
Yeah, that'd be wonderful. I think having this public-private partnership that can really stimulate getting the resource, doing the post-work reconstruction support. One of the audience member, Mary, so she's asking, how can we be most useful? Again, being we, most of the audience member, work, physician, nurses, like we work in American hospitals. Like, what are the things? Is it donations? Is it helping with, physician medical expertise, or what?
Yeah, I think donation is bad. It's good one, and one of the instruments of support in Ukraine, and we have a lot of donations that I will be also very, very thanks for them. But I think if we have this specialized telemedicine secrets webinar, I think we should also say that telemedicine in Ukraine, we have a lot of electronic decisions and digitalization decisions in Ukraine, not only in medicine as a medical system, but also in state. We have electronic passport, electronic license, driver license, and a lot of other documents, and we have possibilities also in electronic documents in the medical system also. But at the same time, yes, this additional expertise of doctors and even nurses. Okay. And I know that we have a lot of nurses associations that really maybe them will be interesting to have this connection and consultation sometimes, because some of them can be just burnout and not understand even what is better to do in this other case. So I think this telemedicine, like a doctor, via doctor, nurse, or nurse, or some consultation, it's really helpful. And I know that we have such possibilities to make some platform and contacts, and I think it will be for some maybe small hospitals even it will be some modern solution. In this case of some places we have a lack of doctors, medical professionals. So yes. Okay. And about this telemedicine also that we have Ministry of Digitalization in the government, and we have electronic system in health. So we have central database that also belongs to Ministry of Health, and we have this medical information system that working in each hospitals. We have different medical information systems, on more than 50, and all of them this electronic appointment that we said, electronic visit to the doctor, for example, electronic recipe, electronic some medical records. So they are, but they mostly they are working just on the territory of the hospital, and we need really help them to be to have these connections outside of the hospital with other hospitals, other doctors, even it will be abroad.
Okay, that makes sense in there. So we have an audience member from Earth. He's asking, in these sort of very difficult times, so how difficult is to access telemedicine? For example, if I'm a patient, is it more like I just know my doctor, he's on Viber, I call them. How do I, is there a hospital official, online booking appointment? I guess, how do people go about doing telemedicine?
Mostly, if we just saying that about telemedicine now, it's just in connection with my family doctor. This family doctor primary care, it's mostly using this Viber messengers communication, and less number of this telemedicine consultations we can have on the special level. Mostly because it's provided by private hospitals, private doctors, and they covering not a huge number of patients. And most hospitals, private, state hospital, public hospitals, are not go to this platform. I can explain maybe in most cases because we have this lack of good qualified management of the hospitals. Because for doctors, I think for sometimes it will be easiest just to go to telemedicine. But if chief of the hospital not allow, for example, and it will be complicated and some conflicts needed for them.
That makes sense. So we have audience member Dr. Garcia asking, you know, that right now there's like many physicians around the world, in particular specialists, you know, that would like to donate their time to just help, you know, for the all things Ukraine in this. Like, I guess, do you consider this to be a viable initiative to pull in? And then specifically, I know there's a lot. For example, let's say there's a specialist, they would like to volunteer their thing. Do you have like a list of places they can match up, or like just how do they go about, you know, making themselves available?
That's a very good question, because you know we can find different cases. In some cases, we can find, for example, I think that, we have very good one as example, association as NGO, Association of Anesthesiologists, and they have very good connection with abroad colleagues, and they have often some possibilities and using emails, some consultations via doctor.
Yeah.
But in the same time, especially in Western Ukraine, a lot of doctors have possibilities last 20 years. They have a lot of visits to different Polish, for example, hospitals. They have private contacts with other colleagues in Polish, and they can just in private manner just call and ask for some consultation. So it's not organized as a hospital system, and it's not organized on the level of the state for all of that. But as I know for now, Ministry of Health, it was announced on the last week, they're creating some platform for consultation from military doctors with public hospitals.
Yeah.
In some cases to have consultations via doctor, because sometimes it's really, they have complicated cases just on the field. And,
okay, that makes sense. I think, yeah, in the end, it's a lot of time is having this sort of physician-to-physician relationship easy to activate. Often these infrastructure will take some time to build out.
Now that some private hospitals also they have such additional service like consultation of foreign doctor.
Got it. Okay, I think that's
they are selling such services also.
Okay, we definitely would love to help through one of our partner organizations, CTEL. I think they have now thousands of American specialists part of our volunteer network. We definitely would love to maybe support you guys. We have a follow-up question from Dr. Garcia. So how advanced is IT infrastructure? Because we read that Ukraine has a fairly advanced IT infrastructure. So now given the war situation, in general, it's a mobile service, network is still pretty good. I guess what I mean is if you're going to do telemedicine, you need to have good cell phone network to make the video calls and so on. Is that still pretty good right now?
Yeah, so mostly it's internet, mobile internet or internet by Starlink or just in some facilities provided, Wi-Fi and so on. And yes, but we have such additionally needed electronic documents. Even I just can show you that I have in my phone and my passport and my driver's license, and I'm not bringing my all documents. And all these documents are really legal documents that I just need to have with myself. And that's why a lot of Ukrainian citizens are caring about internet on their smartphone, because they just need to have a document with them. That's why in this challenges of the war, first case it may be all carrying maybe water, some food, and internet on the phone. And Starlinks also and other possibilities also helping to cover Ukraine. And also we have opened a lot of public places, open Wi-Fi's. So if we are saying to have access to internet, it's really sometimes better situation, or even mobile phone, because in some regions of Ukraine we still have these gaps of mobile connection.
Yeah.
Yes, IT infrastructure in Ukraine, it's really developing, but in rural areas sometimes we can have some gaps, but mobile internet connects to overlap in sometimes even traditional internet also.
Okay, that's good to hear. We have a question from the audience, Mary. She's asking, how are the children coping with the mental health, emotional stress of the situation?
Yeah, I think it's the biggest problem, I think, in Ukraine.
Yeah.
Because in medical system, healthcare system in Ukraine, previous years, 30 years of independence of Ukraine, they have just psychiatry systems and clinics, but not mental health, not psychotherapy, and so on. And they just started to creating a basement of legislation of these services. And it means that we have not good enough network of the specialists. We haven't requirements, standards. So we have a lot of specialists that working with victims from 2014. So we have 8 years, a lot of specialists that helping. But I really worrying how and now they are qualified.
Okay.
How can they or not to make some trouble more or trauma more bigger than it was before. But we have a lot of international projects started before this February, taking into account a lot of other international projects about mental health. So they are supporting this, preparing these mobile groups of mental health supports and so on in these places of replacing people. They have volunteers, a lot of volunteers also. But if we are really worrying about mental health generally, it's a very serious problems that we have now and really will have in future. But in the same time, I just need to mention that we have a stigmatization still in society. Just go to psychotherapy like something not for real guy, something.
Yeah. So as we coming up the tail end of the hour, again, we're so honored, privileged to have you on this so much. Thank you so much. Is there anything final you can share with our audience? So what are some final things?
Final some maybe I can just say that what we really need, we need a peace and stop this war and finishing this war. And we pray. And after that, Ukrainian doctors really sufficiently competitive to doctors from other countries, even from United States. You will see. You just need this. We have just need to have this peace time. You will know that Ukrainian doctors are creative, flexible, stress resistant. And this case, 3 months is last 3 months is really it's as evidence of that, and highly motivated to help patients. Even they have not enough resources, even they have not very good chief of the hospital, even they haven't enough time, they really are highly motivated. So Ukrainian medical system have a very good potential, and at the same time we in this time of globalization, not use all these possibilities that really are for us. So we are just in their way of transforming and developing Ukrainian health system.
Oh, wonderful. We definitely we would love, be honored if we could be a part of the support of, again, so we have access through, I think, so telehealth for Ukraine, by the way, for the physician who's listening. So telehealth for Ukraine is our partner organization that can source a lot of physician volunteer. We would love to get from their specialists to financial resource to help rebuild Ukraine, then turn that into hopefully create a healthcare system that would be the envy of the world as soon as the world wrapped up. Zoryana, thank you so much for, again, so thank you for speaking with us today and sharing with the Ukraine healthcare challenges. And do you have the final slide? You can bring this up. Okay, so and again, so we really want a big thanks for. I know this is you've given all the your extremely stressful situation and still having time to talk to it. I really appreciate. I just want to maybe thank our nonprofit partner, American Duty. You know, if you want to make a donation, definitely please go there, and they will support us. We also, for if you're physicians, our nonprofit partner is a telehealth for Ukraine that's run by the CTEL organizations. And again, this is where we have now had thousands of physician volunteers already. It's a huge labor pool. We're ready to devote to Zoryana to whatever you see as fit in this. And lastly, our AMI service. This is a service we stand up, our dispatch system that able to support all things Ukraine, where we're collecting cases in there. Again, big thanks to everyone who's joining us today. And again, Zoryana, thank you so much for your time. I really appreciate it.
Thank you. Have a nice day.
Thank you. Thank you.
Thank you.
Okay.